Good morning. I'm going to do a tracheostomy care. So the first thing I'm going to do is check the patient's chart. That should also tell me kind of what kind of trach they have, and if they have one that has a disposable inner cannula, so that way I need to take my appropriate supplies with me. So always I want to take anything for suctioning, and I also want to have my tracheostomy care kit with me. So when I'm ready, I'll knock on the door, introduce myself to the patient, and so I'd say, "Hi, my name is Amy. I'm a respiratory care student with the respiratory care department." And so with that, then I would always check the patient's ID band, wash my hands once my hands are clean, and then I'd also want to let my patient know what I'm going to be doing. All right, so good morning, Mr. Johnson. I'm going to do what's called a trach care. And so this is just, I'm going to clean around your tracheostomy here, the trach here. So it's just a tracheostomy care kit that I'll have with me, and I will clean everything. That way we don't cause any infections, and I'll clear out any secretions, excess secretions that you may have. That way it'll be a little easier for you to get that air down into your lungs. So when I am ready, then I will make sure my hands are clean. Once I have everything, I would apply my appropriate PPE. And then I would always, when I'm ready, I would check the patient's vital signs. Before I do the trach, before I remove it or anything, I always want to listen to the lung sounds, listen to the trach, around the trach, make sure everything sounds okay before I begin. And then once I'm ready, I have my PPE, so I'd have, like, I could do a face mask or anything like that, just in case if there's any splashing, anything that could come up and splash on me. That way I protect myself from any secretions or anything like that. So I'd open up my Trach Care kit. Since I don't have one, I'm just using this as my Trach Care kit. Then I'd have a sterile kind of drape just to kind of go over, just in case they have any secretions. That way it doesn't get on them when I'm cleaning or anything like that. And so when I'm ready, then I would always check the trach before I remove it or anything, and just kind of see what it looks like, kind of see if I need to remove the inner cannula, if it's a disposable one, or if it's going to be one that I have to take out and place back in with and clean it and stuff. So I prepare my normal saline with my then peroxide. So when I'm ready, I go into suction before I do any of the cleaning. I always want to suction out anything that may be in there, excessive secretions that may be kind of just sitting in that trach there. And so if I have one that can be removed, there would be little clips that I can take it or remove it from the patient. And so we always want to dispose of, like, old gauze, like the old gauze pad that would be underneath it. You always want to dispose of that. So you take it out. So if it's a non-disposable one that can be removed, then you would take your peroxide and you go and take, like, pipe cleaner or a brush that may be in your kit. You can have a kit that has a brush in it, but you take your peroxide, and so then you just go inside, clean everything, and then you would make sure after you're done with that, you would dispose of your one that you used to clean it with, and then you grab another one with, or you clean it out then with normal saline, just that way make sure that peroxide's out and it's not gonna harm the patient and when you place it back in. And always let it kind of air dry a little bit before you place it back in to the patient. And so when you're ready, before you place it back in, always hold your stoma, and you would always clean around the stoma underneath. And then you kind of clean around it to where you clip it in, just to make sure, because sometimes you can get those secretions on the outside. So you want to kind of clean around that there and just make sure it's nice and clean. And then when you're done with that, then you can place on, so I'm just going to use this as like my gauze here. You always want to place a new gauze pad underneath the stoma and everything. So you just kind of place it like that. And so your stoma just kind of sit like there, and then you go around it. So you just place it there like that. And then if you need to, you check the band. So sometimes the band may need to be removed. So you would always hold the place there, neck plate in place, and make sure you carefully remove it and check to make sure you don't move your trach that's in place, so you don't have any complications, have any air in other places that you don't need to be. And then you would replace it. If you need to, you can have somebody also hold it if you feel more comfortable having somebody hold it and placing one on. But always make sure you can fit 2 fingers underneath the band, so that way you know it's not going to cause any sores, anything on their neck, around their neck there area. So after we did that, and we place, like if they have a disposable inner cannula, you always dispose of the old one and replace it with a clean one, and make sure it's nice and clean before you place it in there. No cracks, nothing that can cause any infection towards the patient. So when we have that ready and that's all in there, everything looks good, we replace the gauze. Then we would always dispose of, make sure everything we had disposed of, especially dirty cleaners, anything that needs to be disposed. The other thing is, after we clean out everything, we always need to listen to the trach. We also need to listen around it. We need to listen to the breath sounds, make sure everything sounds okay, and check the vital signs. But you would always remove your PPE when you are done checking the patient and everything looks good. You would always wash your hands, and when you go, when you leave the room, you always want to go chart on the patient's chart the date, time that you did the procedure, what kind of procedure you did, and to let the nurses and doctors know that you did a tracheostomy care.